Sepsis and cancer. What should you know? What is sepsis? A life-threatening reaction to infection, a medical emergency. However, sepsis can be treated if caught early enough. What is the link between sepsis and cancer? Having cancer and some cancer treatments, such as chemotherapy, reduces your ability to fight infections. Infections can sometimes develop into sepsis. Infections and sepsis. Infections left untreated may lead to sepsis. Sepsis left untreated may lead to organ failure and even death. At the first sign of infection, call the number on your alert card any time, day or night. Reducing the risk of infection after your chemotherapy treatment. Avoid contact with others who are unwell with infection. Good hand washing. Good food hygiene. Be aware of the symptoms of infection and report early. How to recognise an infection. You may feel feverish and unwell. You may feel like you have the flu, passing water more often than usual or painful to pass water, vomiting or diarrhoea, chesty coughs, redness, pain or weeping from a wound, a high temperature above 37.5 degrees. How to recognise sepsis. High temperature 38 or above, or very low temperature below 35.5. Severe shivering episodes, feeling breathless. Slurred speech or confusion. Feeling dizzy or faint. Cold, clammy, pale or mottled skin. Sleepy and difficult to wake. Fast heartbeat. Not passing water for a day. What should you do? At the first signs of infection, call the number on your alert card. Any time, day or night. Do not wait to call us. Do not leave it and hope to feel better in the morning. Ignore any symptoms of infection or high temperature. Think it's not worth calling us about. Think that you are bothering us. We will ask you some questions. Your details, including hospital number, type and name of treatment, when you last had treatment, questions about any symptoms you may have. Whenever possible, please call us yourself. To assess your symptoms fully, we need to speak to you and not a friend or relative. You may be okay to stay at home or asked to come into hospital. Planning ahead, you should always carry your chemotherapy alert card to show to any healthcare staff treating you. Talk to your family and friends about the possibility of having to go into hospital at short notice. Carry contact numbers for your family and friends. Plan for anyone who depends on you for care. The technical stuff. Summary. White blood cells are an important part of your immune systems because they help to fight off infection. Chemotherapy works by killing fast-growing cancer cells in your body, but also kills other cells, such as your white cells. When you have low levels of white cells, your body cannot fight off infection as easily as normal, so you're more at risk of developing sepsis. Remember, infections left untreated may lead to sepsis. Sepsis left untreated may lead to organ failure and even death. At the first sign of infection, call the number on your alert card any time, day or night. Thank you for watching. Further information is available from UK Sepsis Trust, UKST website, NHS Direct Wales website.